ABC 10 News at 11 starts now.
The FDA is aiming to approve the Pfizer vaccine as soon as Monday. Good evening. Thanks for joining us. I'm Steve Atkinson.
And I'm Kimberly Hunt. Local doctors hope full approval will increase vaccinations in the county. Our Sophia Hernandez tells us how this upcoming decision could impact San Diegans.
The FDA hoping to approve the Pfizer 2-dose vaccine by Monday, making it the first COVID vaccine to not be classified as emergency use. San Diegans believing for those hesitant, this could be the game changer.
I think it will make a difference to some people, just that much more verification that it's a safe thing to do.
No, I think it will. I think anything when it's FDA approved, increasing that confidence in a vaccine is terrific.
Dr. Alulade with Sharp Medicine says while Pfizer is the first, Moderna and Johnson & Johnson following suit.
We should hopefully see that they also get approved, but they're going to do their due diligence and follow all the steps, which is a good thing.
Medical experts say while local rules and regulations could change to include more vaccine requirements, they are not anticipating it. Dr. Alulade says the vaccine's efficacy has always been the same.
This actually is not anything new. It's still a vaccine that works. It's still effective. So I don't expect that it will change anything.
Dr. Alulade says the process of changing to FDA approved is more of a formality and should not have those who already got their dose second guessing.
We've had millions and millions of people that have been vaccinated and have not ended up in the hospital and haven't died. So it doesn't really change much for the average person. It really is the end of a process. And I think it's a good thing that they didn't rush it and they weren't succumbing to pressure from all sides that I'm sure that they were getting. They took their time, and it should inspire confidence in the American people.
Dr. Alulade says that given the Delta variant and ICUs becoming full once again, she hopes that this inspires those who may be hesitant to do what they need to ensure not getting infected. In San Diego, Sophia Hernandez, ABC 10 News.
Thank you, Sophia. A California judge ruled tonight that Prop 22, which exempts gig work companies such as Uber and Lyft from treating drivers as employees, is unconstitutional. The Alameda County Superior Court judge said that the measure infringes on the legislature's power to set workplace standards. He said it makes the entire ballot measure unenforceable. It's a blow for Uber and Lyft, which spent hundreds of millions of dollars to get the prop approved last November, and the ruling will likely be appealed.
Scripps Health has announced it is delaying some non-urgent procedures because of the significant staffing shortages it has. It comes as COVID-19 cases continue to climb and hospital staff is overwhelmed. The president and CEO of Scripps Health says that they are taking a proactive approach so staff doesn't get burned out. He says this will likely not look like it did last year when all elective procedures had to be canceled.
If it's not an emergency case, maybe a case can be delayed a few days or a week or even a couple of weeks. And it could be everything from, a heart case that is an emergency that could be delayed a little bit, all the way to other surgical cases or other kinds of procedures.
He says doctors will decide what cases can be delayed and notify their patients. Right now, Scripps is looking to fill over 1,300 positions, but that's compared to over 800 open positions in August of 2019 before the pandemic.
San Diego's Old Globe Theater is the latest business to require proof of vaccination or a negative COVID test. The theater says the new policy takes effect on Tuesday. After that, anyone with a ticket to a performance will need to show their vaccination proof or a negative test at the door. The theater added that masks are optional at the outdoor theater in Balboa Park. They will be required for everyone once the indoor performances resume next month.
And with children heading back to school, COVID is already beginning to spread across some campuses. That's led to a big push to get students vaccinated. So today, a nonprofit hosted a pop-up vaccination clinic at Chula Vista's Learning Community Charter High School. The county says 64% of children between the ages of 12 and 17 have received at least one dose of the COVID vaccine. Those who missed today's pop-up clinic will have another chance tomorrow afternoon in National City, outside the Seafood City on Plaza Boulevard.
When we get vaccinated, we are protecting our community and healing our community, and as a result, we are stronger together.
And those who get shots, they do get some free food, courtesy of a local Filipino community group.
And turning to our local cases, there were nearly 1,500 new infections reported today, and the number of deaths is again on the rise. 7 more San Diegans have died from the virus.
San Diego's nursing homes and long-term care facilities are ramping back up as they prepare to distribute the COVID-19 booster shots. Our ABC 10 News reporter Nia Watson shows us how one program plans to handle the massive rollout to their residents and their staff.
Nursing homes and long-term care facilities were among the first on the list to receive the COVID vaccine back in December and January. Now they're working to keep their residents and staff safe with booster shots. Come September 20th, anyone fully vaccinated will be able to receive a booster shot, gaining extra protection against COVID-19.
One of our staff or our seniors who got the vaccine in December, of course, they are now 9 months out. And so they're very excited to think about getting a booster.
CEO of St. Paul's Senior Services, Cheryl Wilson, says they plan to roll out the Pfizer vaccine. They hope to partner with CVS again to help administer the shots.
So we had very good coverage right out of the box.
Wilson says they've been pretty successful keeping the virus at bay. 98% of their residents are fully vaccinated and 86% of staff. But the Delta variant is causing new concerns. Through COVID tests conducted each week, some people tested positive.
These people who have been vaccinated are not getting sick. They're not having symptoms, but they are positive.
When it comes to distributing the booster shots, it's no small feat. The network serves around 1,700 residents and 650 staff members. Wilson says getting the shots to hundreds of homebound seniors, along with the cost of the rollout, are the biggest challenges.
We think the same thing will happen this time, where we will not have to actually pay for the vaccine, but we do have to pay for the syringes, the nurses' time, everything else that goes along with it.
The program will also require all of its staff members to be fully vaccinated, as mandated by the Biden administration. If someone is unable to get the shot, they'll be provided with special face masks, gloves, and gowns to not only protect themselves, but those they care for.
The Delta variant is out there, and we are watching it very closely. We do not want any of our seniors to get sick, and certainly not end up in the hospital.
If they can get enough vaccine, Wilson says they'll also provide booster shots to residents and employees' family members, as they did previously. Nia Watson, ABC 10 News.
President Biden pledged to bring home all Americans in Afghanistan. He delivered that promise today while giving an update on evacuation efforts in Kabul. The Taliban has controlled the Afghani capital for nearly a week after overrunning the government last weekend. President Biden added he is committed to helping Afghans who assisted the U.S. during the war.
There's no one more important than bringing American citizens out. I acknowledge that. But they're equally important almost is all those SIVs, we call them, who in fact helped us. They were translators. They went into battle with us. They were part of the operation.
The president originally said the U.S. will be out of Afghanistan by August 31st. Today, he suggested the withdrawal deadline could be adjusted. The Herculean task of airlifting people out of Kabul after the Taliban took full control of the city has been chaotic, leaving tens of thousands in a dangerous situation, desperate to get out.
Speaking of that, in the meantime, a former Afghan interpreter now living in San Diego says that Taliban soldiers have begun to hunt down the family members of translators, and there are reports they do have a kill list. Our ABC 10 News reporter Michael Chin reveals why this translator's loved ones may already be targeted.
Raim worked as an interpreter for U.S. troops for 4 years before emigrating to the U.S. under a special immigrant visa in 2016.
I'm not in a good emotional situation now.
Since the Taliban takeover, he's been constantly on the phone and online with advocates and scared loved ones.
All terrified.
Raim's parents and 9 siblings live in Kabul. While some have worked with the Afghan government and military, none qualify for the special immigrant visa. But Raim says their lives are at risk because they're related to him.
I feel guilty. If God forbid anything happens, I would be the responsible. They're paying for the consequences of my action.
Despite the Taliban's vow not to harass people, Raim says his family has told him the Taliban has begun targeting relatives of Afghan interpreters.
Taliban started the night operation, going house by house, checking for people.
Raim says his neighbors are being recruited to be informants near the home of one of his relatives.
2-3 blocks down from our house, they took in people from their homes.
Raim tells us several family members have sought help at the French and other embassies to no avail. Some have tried to get to the airport but didn't get far amid the crowds and Taliban checkpoints.
Gunfires, their tear gas is going out there to control the situation, and then it's really hard to take your family.
Raim says he's hoping the U.S. will do more to stabilize the area outside the airport to allow for safe passage. Meanwhile, Raim can only wait.
You feel helpless
and worry.
I fear that they will come after my family, and that could happen at any moment.
Michael Chen, ABC 10 News.
Raim says that some family members are trying to apply for an emergency visa from India, anything to get out of the country.